Good evening to all. Tonight we are going to see the remaining part of curriculum. Already we have told you the first step is the formation of philosophy. Second one is development of educational objectives. Third one, organization and learning experiences, and will be evaluation. Selection and organization of learning. Okay, whatever it may be, the first video we have seen about what is curriculum. Curriculum is sum of a total learning experiences planned for the particular group of students in order to achieve the educational objective. We have seen types and all. Well, the missing one we told this video will continue. Can anyone tell about the principles of curriculum?
Okay, ma'am, that's the first of principle is conservative principle. Then
Forward looking principle.
Yes, ma'am.
Forward looking means the curriculum should think if the population is exploring and which kind of population is increasing, geriatric or the cancer is increasing, it should forward look and add those subjects into our curriculum. That's a forward looking. Yes, very nice.
then creative principle.
Yes, creative. You see, now we are doing creative. We are doing a discussion, panel discussion, portfolio. That's very important. Then only the education will be enjoyable. Otherwise, it's boring. Next,
Then principle of integration.
integration. You have to integrate with what they have to learn theory into practice. You have to integrate. So not only teaching theory, lab you have to integrate. When you are doing the lab, you have to integrate the anatomy knowledge, physiology knowledge in the lab. That's called integrated curriculum.
Then principle of loyalty.
Loyalty. Curriculum should be loyal. It should meet the objectives what you have set for the particular group of students. Next is
Then principle of utility.
principle of utility. The curriculum what the students are studying, they have to utilize in their life. That's very important. That's why we are teaching. If they are learning something back, what they have to use in the community. Something they are injection, we are teaching in the lab, they have to use those technique correctly. Are you understanding? When my father was admitted, IV fluid when you are putting, there is a two openings. One opening open, one opening here. One cap will be attached. The nurse is remove the cap and put it down and pushing and she will go. Why the cap should never be kept inside. That's what we are teaching here in the lab. The cap should be put it back. If this one will be, you use it, either close it or if you open it, you put it in the another one because it's open. You are connecting IV. So you open this cap, pink color cap, you open it and put the another cap. It's very important. So when I scolded them, they told me, ma'am, we did not study. That's why the student not, because it's a small nursing home, not a BSc nurse is working there. So then I teach them. This is how. Otherwise, it is IV fluid. Directly microorganism will enter and cause the septic shock.
Yes, ma'am.
Correct or not? We lost our one of our student. Septicemia affected her meninges. Simple mistake. That's why we curriculum using the scientific principles in everything. Patient preparation inside all this each curriculum will be different. If engineering curriculum, it will be different. Understand? Okay, so you understood one. Can you read one time what are all the principles for them?
Okay,
Yes.
ma'am. At first, conservative principle, then forward-looking principle, creative principle, principle of integration, principle of loyalty, principle of democracy, then principle of utility, and principle of character building.
Character building. The end result of the education is change your behavior. Behavior is nothing but otherwise it is called your character. Right or not?
Yes, ma'am.
What you perceive, it will in your thought will come as action, action become a behavior, behavior become a character. Once it is internalized. Yes, here is the point. The second objectives of the curriculum is development of educational objectives. Are you understanding? Anyone can tell what are all the qualities of educational objective, how the educational objective should be?
Qualities relevant,
Relevant, yes, relevant.
and then observable,
Observable, measurable, yes.
clinical, topical,
Okay.
logical.
Logical. It should be logical. I cannot tell in this curriculum within this period I will go to the take you to somewhere. I cannot begin with 6 months. What is the curriculum? Then you know what is SMART in writing objective? Yes.
I can tell you what is SMART. S for simple, M for measurable, A for achievable, R for realistic, and T for time bound.
It is so easy mnemonics than what she has told. Is there any characteristics or the qualities of the objectives? You can say A, B, C, D characteristics. You know.
Yes, ma'am. 4 elements are there.
Elements of the curriculum. That's also a character. Tell me the elements.
Activities, content, condition, and creation. And we are also telling the A, B, C, D. A for audience, B for behavior, C for
A for activity, B for
activity,
behavior,
C for content, and D for degree or creation.
degree of criteria. Degree of criteria.
Yes.
So what is she told? Activity, content, condition and criteria. I am going to tell one objectives I am going to formulate. You are going to see this objective having these 4 criteria or elements which are. Okay?
Yes, ma'am.
Listening? Okay. A student, yes, second year students can tell 5 principles of bet making to say to the teacher in the classroom. Can you tell me what is content, what is criteria, what is that? Can anyone tell what is content?
Ma'am, please
Content
repeat the
was-
question.
Yeah, I will again repeat. The second year students can say, could say 5 scientific principles in the classroom. What is the activity? What is the content? What is the criteria? What is the, yes.
The activity was say the
Saying the acts is the activity. Criteria?
criteria, ma'am.
In classroom.
In the classroom.
5 is the criteria.
5 principles. That is the.
Are you understanding?
Yes, ma'am.
Behavior is saying. She is not going to. Condition is verbalizing. Are you understanding?
Yes, ma'am.
So, any objective. Are we developing? What are all the types of objective you develop? Can anyone tell what is the types of objectives?
Yes, ma'am. There is the general objective and specific objective.
Anyone can tell your practice teaching what is the general objective you formulate at the end of the class? Tell me.
Yes, ma'am.
At the end of the class, students will learn in depth about family planning. You have done a family
Yes,
planning
ma'am. Yes,
in a community.
Yes, ma'am.
She has done. So what she is at the end of my community, people will be learning about family planning. Then what is specific objective? Define family planning. List down the family planning. What are all define these verbs? The verbs are we are going to use. We will discuss it before. So you understood what is the definition of objectives? What is the levels? What is the levels of objective, ma?
Institution,
Institutional. Okay.
industrial,
Industrial.
and enabling objective.
Enable objective. The students can perform injection in the classroom or in the lab. It's a enable objective. Are you understanding? It is the institutional objectives. Every institution have its own vision, mission, strategy. They create objectives. At the end of the PSC Nasik program, the students who come here, we are equipping them to participate in multi-level examination. NARCET, AIMS or this we are developing. Like that one organization can formulate fascinated objectives to attract the students. Where you find the institutional objectives? When you found the Disari website, you will be written vision and mission of Disari. Objectives means understand? Yes, so you understood the levels of objective. You can put, whenever you are presenting 2 mark, 5 mark question, you just present it, put the levels. It's like a institutional big, small one. Enabling objectives, many. So put more points. When put a Venn diagram, few. But enable objective students can develop. All these verbs will be more. Are you understanding? Okay. Let us go. Who is the person giving guiding principles and verbs given by one of the iconic person? That is the important questions also asked for the MSc and BSc students. There is a dash objectives. Who is the person? Can anyone tell? Blooms. Blooms is the person. Bloom's taxonomy of educational objectives. How he categorized objectives? Anybody? How many domains he categorized? 3. Three. Use mic and three domains, right or not? Three domain. What is the knowledge domain? What is the three domains? What is the first
Cognitive
one?
domain,
Cognitive domain. Otherwise, it is called knowledge domain.
then affective domain,
Affective domain. Otherwise, it is called behavioral domain. Next is the
psychomotor domain.
psychomotor domain. Can anyone tell the levels? How many levels? 6 levels are there.
levels are there.
Cognitive. What is that? Knowledge, comprehension, and application, analysis,
synthesis, and
syn-
evaluation.
synthesis and evaluation. Again, repeat it.
Knowledge, comprehensive,
comprehension,
applications,
application,
analysis,
analysis,
synthesis, and evaluation.
Commonly, we are using this domain. Right or not? Can I tell first what is the domain? Knowledge. Are you understanding? If a kindergarten student's teacher is asking, I bring one apple. Are you understanding? Knowledge about the apple. First is the knowledge, verbs, what and all I can use. Define apple. List down the colors of apple. So what is the apple? Apple is a fruit. It is like that you can write this is the tree, it's coming from tree where the trees are living in the Himalayan region or there is a hilly region, whatever it may be, right? What is the colors of apple? Can anyone tell what is the colors of red? Red, yellow, pink, like green. Green apples are available. That's a knowledge. Yes, yes. Comprehension, I'm using the correct comprehension. Right or not? I remember A, the phonics, they will tell, they will, right or not? My father is the English teacher, he'll ask, you are telling A, you will tell apple. Are you understanding? So, the comprehension in the objective very important. What are you doing? Apple. It's coming from apple, not apple. Are you understanding? Comprehension. You are understanding what is it, you are analyzing from that. What is the third one? Comprehension and analysis. Here is the point, analysis it, what is present in the apple. There are many proverbs telling that apple a day, keep a doctor away. That why we have to, it says that we have to application of the apple. So when I tell, when you cut the apples, how many, analyze how many seeds are in the apple. When I cut the apple, why the apple turns into brown color?
Because of iron.
Because of iron. Use the mic, it will not be. Because of iron.
Because of iron.
Which are all the vegetables turns the colors into?
Those who are
Begoon,
brinjal,
banana. All these vegetables are turning in the color. Whatever this iron. Potato also sometimes. Okay. Bengali people will never leave the potato. Don't leave potato, madam. Okay. So, what I am coming is telling analysis domain. So, I am going to analyze since iron is there. How much iron is present? I am going to analyze. Oh, iron is there. I am analyzing. How much iron is there? Compare with another. This analyzing. Why the color is changing? How many seeds are there? Apple is healthy, but apple seed is like a poison. Are you understanding? I am analyzing the apple. That's the verbs what and all we are using. What is the next domain? Analyzing. Next one is the?
Effective domain.
No. Another domain. What is that? Synthesis. Synthesis is a kind of finding a new knowledge. Okay, I will find a new knowledge. I will give apple for some person. I will not give apple for some person. I will find how many grams of hemoglobin is improving. There is a proverb says apple a day, keep a doctor away. If I give, then I can analyze as a community. Apple is so costly. So my community people, Kejur, what is Kejur? Dates are good. So I will give one group dates, one group apple. Synthesis is the new knowledge. Are you understanding? After synthesis, what is the next step? Evaluation. I last evaluate how many gram is increased or not. Okay. Now you are going to tell me. Understand the meaning? Yes. So this is what will be happen in your real education. Just we took apple for the kindergarten teacher to educate the children. Same domains we are using in our college. Even a surgeon will be used for surgery. Engineer will use for this domain to give knowledge to the machines. Are you understanding? Yes, now, as a teacher, we have to use what kind of verb? Knowledge. What all the verbs will be used? Anybody? Knowledge, what are all the verbs? Always we are knowledge question. What is the color of the apple? What the verbs? Tell me the verbs.
Define, define, list, name, recall, and identify.
Yes, identify the color, identify what vitamin is there in apple, list down the colors of apple. Is it simple? What is the next domain? Next, I mean not a domain, not is the next verbs will be used
Comprehensive.
for next level.
Comprehensive.
What are all the verbs will be used?
Explain, identify, and describe.
Explain, identify, describe. What next level? Tell continuously.
Applications.
Application, what are all the verbs will be used?
Choose, select, apply, and used. Then analysis. Analysis are the diagnosis and keep breakdown. Then synthesis. Synthesis are the develop, design, plan, and organize. Then evaluation. Evaluation are the evaluate, judge, justify, and assess.
Justify why we have to eat. Justify how many grams, how you applied, where early morning you gave or when you gave, like that. These verbs can be used. Mostly we are using the knowledge verbs. Okay, define, list down, explain, recall, that's
Identify.
the word. Yes. What are the another level? Cognitive domain. Next is called the affective domain. Can anyone tell the levels of affective domain?
Effective domain is the receiving, responding, valuing, characterizing.
Organizing, characterization. Are you understanding? You left out. What is receiving? For us, community health nurse, I go to the community. I make the baby bath. I'm just teaching the mother how to do baby bath. She will receive by perceiving. Receiving. Are you understanding? After receiving, she respond. Yes, madam. I also give massage when I am doing. From lower to upper, she will tell. Receive, respond. Then she will value what she is doing, what I am doing. She will be valuing. Then she will be organizing. Organizing. For example, when maybe mothers will be completely take bath, but our bathing principle, what it is telling, in the cold climate, if you make the baby bath in this, immediately wipe the water. If you first wash your face of the baby, hold the cover the neck, hold the neck plus cover the ears and wash the face, immediately wipe it. That mother may not be doing. So she is valuing. I do like this, but I forgot to wipe the face. Then first I will be back or front. First I will front, clean area, there is unclean area. The massaging. Oh, I do, but massage I will not do, madam, I value. She organized. So next time when you go, she already received. Are you understanding? She already respond, already valued, she characterization. Whenever she give baby bath, she mix the water like me, check the water like us and start wipe the baby's face first, wipe it with a towel, then started to give the clean area to unclean area with the massage. So this is how. Are we applying? Are we not applying? We are also applying. Are you understanding? We are also applying. We look at the teacher's demonstration, what mistake I have done, and value and characterization. Micro teaching, what it is doing? You are doing it and you are evaluating yourself. You compare and contrast and organize and character. Then when you become a teacher, it will become a characteristics. That you have to wipe the board like this, arrange the board, clean the board. When with the board you cannot talk, you have to talk in the front. Many things. It's happening in our day-to-day life. Then why, madam, you have kept it? Because we are not only putting a knowledge, we are also putting the behavioral, because doing the procedure, consistency of doing, holding the thermometer, our attitude, the behavior, holding the syringe. If you shake like this, how the patient will be happy? So, are you understanding? Okay, can anyone tell all the verbs which is used for these 5 levels?
Okay, ma'am.
Continuously. Say louder.
Receiving, responding, valuing, organization, characterization.
Each verb you explain.
Receiving here the listen with attention, show interest and describe and identify.
Listen here, see it, like these are all the verbs teacher is using. Listen here. You have to repeat, that's a verb. Next.
Responding, helped, respond and comply, answer, participate.
Participate. You do the procedure. Participate is very important. Participate in the baby bath. Participate. Are you understanding that verb? Name.
Then valuing, show interest in the progress of other, describe values,
Describe values.
explain, Then differentiate.
Differentiate. What is good, what you have done, what I have done. Differentiate why you are using scientific principle, why you are not using. Next is
Organization. Recognize, accept, recognize, integrate values.
yes. Understand? Shall we go to the psychomotor domain? Yes. What is psychomotor domain? What all the levels are there? Psychomotor domain?
There will be imitation,
You can see that.
imitation, manipulation, precision, then articulation, and the last one is naturalization.
This every child is doing. You might have seen baby when I was having my daughter, whatever I am doing in the 1 year she was doing. Whenever I am cooking, she take all the vegetables cooking. When she go to the kindergarten, she was teaching like a teacher. Are you understanding? How it is she is doing? She first perceive it. That's what called perceive. And then imitation. Every level is doing. So she imitates, she wear one towel like a teacher. Are you understanding? Then will be precision and articulated. Naturally she will be like a teacher. Are we young, only child is imitating, child psychomotor. It is, I have also some teachers coming to me when I was like a young girl, Sheba her name. She come with a chalk piece. She nicely take from the medical surgical nursing how she is. So I started, there was a one teacher, genetic madam, there was one teacher from anatomy. They come with nothing, with the color chalk piece in the bone, exactly they will draw. With the color chalk piece, so we started to imitate. I have to be like this teacher, right or not? Some young girls going to cinema movie, looking at, oh, I want to be like that. And then there is a clip like a film actor. When you are seeing the film, young children, you will be like a heroine. When you, I always tell them, when they go in the bus, all the boys looks like a hero. She will precise it, yeah, she is simple, dark, okay, no problem. In that Dhanush, that actor is also not looking good, but he is a hero. Manipulate. And then she will make what all the action she has, the heroine done in that same thing she will do. Right or not? That psychomotor, you are this one. So psychomotor you are changing, you can win. That's what many neuro-linguistic programs are coming by many corporates to change your brain function. Okay, let us tell what are all the domains, what in this domain, what all the verbs has used.
In imitation, there will be sense, identity, select, describe, and relate.
You can show that.
Okay, ma'am. And then manipulation, we can say that perform, write, apply, determine, and draw. And the precision will be their perfect, measure, complete, control.
Slowly tell, perfect, measure, complete, like that. How will perfect measure, like how they will understand? Huh?
Okay, ma'am.
It's a tough subject. You know, very tough. How long you taken to read this one? And blah 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 you are telling. Nobody will understand. Viewers will off the video. Repeat again all the verbs.
Okay, in imitation, we are using sense, identify, select, describe, and relate. In manipulation, there will be an perform, write, apply, and determine, and draw. Then precision there will be perfect, measure, complete, and control. Then articulation, integrate, adapt, organize, and also coordinate. And the last one is the naturalization. We are using design, create, develop, master, and construct.
Okay. So understood? What are all the levels? What is the cognitive? Knowledge, comprehension, analysis, synthesis. The next level? Affective domain. What are all that? What are receiving, responding, valuing, organizing, characterization. Organizing. What is the psychomotor? What is the level?
Imitation,
Imitation or
manipulation,
perception?
precision, articulation, and the last one is naturalization.
Only 3 domains.
No, ma'am, 4. Imitation, manipulation,
Manipulation,
precision,
precision,
articulation, and the naturalization.
See, I not understand. How they will understand. It is, so this is the very, very important question. 5 mark question will be asked. Here is the point. We'll come to the point. Where is the application? Are you understanding? For example, now we will take the last video I posted about the family planning. This girl was teaching in the community. So she has to use the objectives. She has to think, in this family planning I am going to use in the community, what is needed, what is my criteria. I am going to give them knowledge, or I am going to demonstrate how to wear condom, or that I have anything. So she is only going to knowledge domain. Understand? So that is the first time. Analyze what are the general objectives which is needed for her to educate for whom? You ask yourself, who, why I am going to use it. In that, possessing knowledge, attitude also. Then second step, you think, in that, does any need skill? Behavior have to be changed, or any, like I told you, I am putting a baby bath in the behavior. Like that, anything. Right or not? Ma'am, family planning, anything needed? I tell you one joke or real thing, it happened. 1960, the government was telling, to control the population, they have given a target approach. Everyone just to go and do the target, anything. Everybody should be increase the family planning rates. Okay, all went to education. You see, 1960s, it's so thing you have to very high. This one, talk about family planning, it's like a sin. So all these multi-purpose male workers went to the many villages, took the condom, they given the free of condom, they call all men to the terrace. Then they told, see, open the condom and put it in the finger. I told, you have to do like this, blah, 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 blah. They went. After 4 months, they visit. I have told the joke. Yes. All women are pregnant. They were surprised. What's going on? What did you do? They call one man. Yeah, you wear it. Where? Here in the hand. Then NACO, that is a voluntary organization, came forward. They collected all the professional people. Then what they taught, they called all the prostitutes. Who is needed to do that? Because they want to STDs. For this family planning, leave it. They not do. The HIV AIDS were very, this one. So this one, not kind of this one. They were like prostitute. They were teaching all the prosthesis of the internal organs. They given to all the people. You have to take the prosthesis, teach the prostitute how to put the condom by her mouth. They taught her, really they taught. So why madam mouth? Because prostitute is the one polluting the community. Understand? Many people will get a HIV AIDS. So the root cause is a prostitute. So not telling you wear condom, they made the prostitute to put the condom in her mouth, put it in the penis prosthesis. So why I am telling is KAS, knowledge, attitude, skill. Everybody needs that. It's not a joke or something I am just telling. Okay, you understand about this? So first step, analyze whom you are taking. Is that need anything? Then apply whether identify the knowledge domain needed, cognitive domain needed, or behavioral affective domain needed. And then write the classify the specific objective. You understood the overall objectives? Then you write overall objective. Overall objectives I want to explain about in depth about family planning. Then you write the specific objective. What you will write? Define family planning. List down the family planning devices. In that list down the simple family planning and spacing method, temporary method. All these you put the verbs. All going to use the knowledge verbs. Because this is not going to demonstrate anything like going the why I tell this example. You are not taken the penis, you are not demonstrated the condom there. I saw only you are teaching. So skill is not needed there. I am just talking, that's why the joke has come in this way. Okay, then write the objectives and check against the essential criteria. Essential criteria, I put this domain, list down all these things, will give my overall domain, whether by fulfilling, and then learning outcomes, you check the specific objective. What is learning outcome? Feedback. Pustaparcho, did you understand? Can you tell me what are all the types of Maladi, Malayan? Can you tell this down? They will be telling. Are you understanding?
Yes, ma'am.
So, today's class, we have seen about how to develop the objectives, various levels of objectives, what is the characteristics of objectives, elements of objective in a detailed manner we have seen for the MSc level. But the BSc students who are watching, the 5-mark question it will be coming, only Bloom's taxonomy of educational question. If it is a 15-mark it is coming, you write detailedly each verbs in each level. So any question you can answer. Thank you.